All right, let's get right into it. We all think of childbirth as this amazing, joyful event. And it is. But what happens when, in just a few moments, a hidden emergency starts to take over? Today, we're going to talk about postpartum hemorrhage, a really serious complication where every single second counts.
So, picture this, a delivery room. A 30-year-old mom, after a very long labor, has just given birth to a big, healthy baby boy. We're talking almost 10 pounds. Everyone is relieved, everyone is happy. It seems like a picture-perfect moment.
But then, the mood shifts. The placenta is delivered, which is normal, but the bleeding, it doesn't stop. In fact, it continues. And that joy in the room, it's quickly replaced by this quiet, intense focus. The real emergency is just getting started.
To really get a handle on what's going on, we're going to follow this specific case. It's a textbook example of just how fast things can change in a delivery ward.
Okay, so here's the rundown on our patient. She's 30, has type 1 diabetes, and just went through a really long labor. But now, look at her vitals. Blood pressure, 120/70, totally normal. Heart rate, 79, also fine. She's awake, she's talking. On paper, she looks stable. And yet, the bleeding won't stop. And that's the scary part, right? A major crisis can be brewing even when the vital signs look okay at first.
And this is the critical clue for the medical team. When they do a physical exam, they feel the uterus, and it's described as soft, enlarged, and boggy. Now, what that means is it's not the firm, contracted muscle it's supposed to be after birth. It's weak. And that one physical sign tells them exactly what's wrong.
So let's zoom out from our specific story for a second, and just define our terms. What exactly is postpartum hemorrhage? The official definition of postpartum hemorrhage, or PPH, is losing 500 milliliters or more of blood after giving birth. Now, to put that in perspective, that's about the same amount as a standard bottle of water. Once you cross that line, the alarm bells are ringing. It's a full-blown medical emergency.
And the number one cause of PPH is a condition called uterine atony. Atony literally just means a lack of muscle tone. See, after the placenta comes out, the uterus is supposed to clamp down really hard on all those open blood vessels. When it doesn't, when it stays weak, you get that soft and boggy uterus we just talked about. And that is what causes the dangerous bleeding.
Okay, so we know what it is, but why does it happen? What are the things that put a patient at a higher risk for this? Well, there are a bunch of potential culprits. Things like having a very large baby, what doctors call macrosomia, or having a really long labor. Twins or triplets, having had many babies before, even just having a full bladder can be a risk factor. And if you think back to our patient, she already had 2 of these strikes against her, a large baby and a prolonged labor.
And some of these risk factors are, well, they're huge. For example, if a woman has had 3 or more C-sections in the past, her risk of a really dangerous condition where the placenta grows too deeply into the uterine wall, it's called placenta accreta, that risk shoots up to over 60%. That is a staggering number. It really shows you how one pregnancy can affect the next.
You know, to really get this, it helps to think anatomically. The bleeding is usually coming from one of 3 main places. First, the uterus itself, which is what happens with atony. Second, it could be the placenta. Maybe little pieces got left behind. Or third, it could just be trauma, tears or lacerations in the cervix or vagina from the delivery itself.
So, with all this happening, how do you even spot the emergency? The signs can actually be pretty subtle at first, and it's really interesting to see it from 2 different points of view, the patient's and the doctor's.
And this is so important, what the patient is feeling versus what the clinician is seeing. The patient might just say she feels anxious or dizzy or really thirsty. Meanwhile, the medical team is watching the monitors and seeing hard data. Her heart rate is speeding up, her blood pressure is starting to drop, and her uterus is actually getting bigger as it fills up with blood. 2 very different perspectives on the same crisis.
So the obvious red flags are, heavy visible bleeding and that soft, boggy uterus. But the scenario that's truly terrifying is a concealed hemorrhage, where all the bleeding is happening on the inside. A doctor might see a patient's heart rate suddenly spike, but see no external blood. That's a massive warning that something is going terribly wrong internally, and it can lead to a sudden collapse.
Okay, so we know the risks, we know the warning signs. Let's get to the important part. What do you do about it? How do you prevent it? And what's the immediate game plan when it happens?
What prevention can actually start weeks before delivery. We're talking about simple things, like taking iron supplements to make sure hemoglobin levels are good. And for patients who are known to be high risk, doctors can give medications like oxytocin right after delivery to help that uterus contract hard and fast from the get-go.
But let's say it happens anyway. The bleeding starts.
the uterus is soft. The very first step in treatment isn't a drug or some fancy piece of equipment. It's immediate, it's low-tech, and it's completely hands-on. And here it is. The first line of defense is bimanual uterine massage. A doctor or midwife literally physically massages the uterus to force it to contract and stop the bleeding. It's a powerful, direct intervention that can save a life, and it was the very first thing they did for the woman in our story.
So that really brings us to the final question, doesn't it? In the middle of a chaotic, high-stakes bleeding emergency, what's the one thing that matters most? Is it the latest technology, the best drugs, or is it the team's ability to see those subtle signs, to know the risks, and to act decisively with a simple, hands-on solution? In the end, being prepared is everything.